Welcome to another edition of Politics Done Right on Egberto Off the Record. Thank you guys for chiming in. Thank you guys for being here. Today we're honored once again to have Alex Lawson. Alex Lawson is the Executive Director of Social Security Works, the convening member of the Strengthened Social Security Coalition, and it's a coalition made up of over 340 national and state organizations representing over 50 million Americans. As you guys know, today, Donald Trump released an executive order that seems to be populist in nature with regards to drug pricing. We need to simply let Americans know right off the bat that this is just one of the other scams that this president is known for. Alex Lawson, Director Alex Lawson, welcome to Politics Done Right on Egberto Off the Record. How are you doing today?
Great, Egberto. Always wonderful to join you. And it's a busy week.
Why is it a busy week? I mean, you mentioned that earlier before we started talking and realized that it's going to be all coming down quickly and we have to have our eyes open for what's about to be unleashed.
Yeah, so it's important for everybody to understand the main event is tomorrow. Tomorrow, the Republicans have to advance their legislative agenda, which is done by Congress. This is the hard stuff. And this is where this is their proposal. They're going to steal 13.7 million people's healthcare, steal it so that they can give trillions of dollars in tax handouts to billionaires. That's what they're going to do tomorrow. Now, remember, you know this, your listeners know this. They've spent the whole time being like, well, we're definitely not going to cut Medicaid. We're not going to. They're just lying about their plans. Tomorrow, they have to sign on the dotted line, right? Yes, they're destroying Medicaid. Yes, that's how they're giving these tax handouts to billionaires. This is deeply unpopular stuff. But and that's not it. They also destroy SNAP. You're coming after the ACA. It's enormous. But all of it comes down to stealing our healthcare, our money, and giving it to billionaires. So they know that that's going to be deeply unpopular. So they put all three committee hearings on top of each other to just try to confuse the story or minimize the story so people don't actually know what's going on. And now you get to why did Donald Trump roll out his executive order on drug prices? Donald Trump's numbers are they're underground. They're so bad on cost of living. And high drug prices are a disaster. Don't ever let any politics, get in the way of the clear-eyed understanding that high drug prices are a disaster for the American people. I moved to Washington, D.C. Over a decade ago to take on high drug prices. I spend every day fighting pharma. This is a real fight. So Donald Trump understands that it's super popular to take on pharma. The problem is Republicans love pharma, right? I mean, Joe Biden took on pharma and won. When he took office, he took on pharma and won. Medicare drug price negotiation. You know how many Republicans voted for that? Zero. You know what pharma hates? Medicare drug price negotiation. The Republicans right now are trying to advance a bill to weaken Medicare drug price negotiations. So Donald Trump is announcing an executive order that, I'm all for. Anyone who says they want to lower drug prices, I'm not going to say that's a bad goal. I'm going to say it's hard to do. And the executive order, you dig into what Donald Trump is actually saying he's going to do, it's not big enough. It's not actually going to lower people's drug prices. It's mainly hand waving. Just to dig into the policy briefly, it's the weakest form of international reference pricing, which is something that I spent years international reference pricing, getting into the conversation. We like international reference pricing. It says pharmaceutical corporations shouldn't be able to charge us in the U.S. way more, double, 4 times as much as they charge in other countries. We got a bill that Senators Merkley and Sanders are reintroducing on Wednesday that's real, a real international reference pricing bill. If Republicans want to make this happen, that's what you have to do. The executive order is just hand waving, smoke and mirrors, because Trump's numbers are subterranean right now. So he's got tariffs the news on tariffs and this EO are all a big PR push to try to win this week with positive messaging, because tomorrow they're going to try to hand wave away that they're stealing almost 14 million people's healthcare to give tax handouts to billionaires. So I know it's complicated, but it really comes down to this. The Republicans are not fighting to lower people's drug prices. They're just not. Right? That Donald Trump understands the politics of it, but the Republicans are not fighting to lower drug prices for the American people. It's not one of their priorities. Their priorities is giving tax handouts to billionaires, and they're going to take our health care to do that.
The executive order is titled Delivering Most Favored Nation Prescription Drug Pricing to American Patients. A tenet of this executive order claims that Americans are subsidizing foreign companies, given that foreign companies pay quite a bit less for our drugs than we do. Here is the thing. The foreign companies, governments fight the drug companies to get the better deal. The drug companies still make a hell of a profit, even at the pricing they give to foreign companies. Donald Trump trying to attach or equate we subsidizing foreign country is a false statement. Now, one of the things that he said during the press conference was kind of ironic because he tied tariffs along with this drug reduction bill by claiming, check out what's going to happen, guys. When we add up the money that we have for the tariffs and the savings we're going to have on these drugs, it's going to make it much easier. I'm paraphrasing. It'll make it much easier for us to give the tax cut. Of course, as Alex pointed out, he means the tax giveaway to the wealthy folks. Explain a little bit about how that ties into the ability for him to give bigger tax cuts to these wealthy guys.
Yeah, it's a lot of what Donald Trump is doing is really bully pulpit stuff. Because at the end of the day, the CBO, the Congressional Budget Office, is the scorekeeper on the Hill, and so on the Hill, the savings that you need have to be legislative, right? It can't be from anything other than cuts. That's why we know what the cuts are now to healthcare. 13.7 million people losing their healthcare. That's from CBO. So what Donald Trump is talking about is softer. It's sort of like PR or also the business press. And now, Egberto, this goes a little bit deep, but I know we can follow it.
We have a great listenership. These folks understand things.
So this is all about, you watch financial press, and what they talk about is bond yields. They talk about U.S. Treasury bond yields. And the underlying thing is, if you give giant tax handouts to billionaires, which Wall Street and the financial press are desperate for, they say, you have to give us trillions of dollars. Otherwise, we won't be able to buy our golden yachts. But they do say, if you don't pair that with actual cuts, then the bond market is going to punish U.S. Treasury bills and drive yields up. And this is actually the thing that spooked Donald Trump on the tariffs, right? It was the bond market that actually went haywire and started signaling that people were losing faith in U.S. Treasury bills. And if that happens, the whole house of cards comes down, the whole kit and caboodle. So what Donald Trump is saying is, I'm going to make sure that the bond yields don't go haywire. And on the legislative side, that means literally cutting people's Social Security, Medicare, Medicaid. They say getting entitlement spending under control. That's Wall Street speak for stealing our earned benefits. That's what's going on. So we have to really focus in on what is being proposed in the reconciliation bill on the Hill, and understand that what Donald Trump is doing is mainly PR efforts outside of that to build momentum for what's on the Hill, because what they're trying to do on the Hill is really hard for them to pull off. It's deeply unpopular amongst both the moderates and the hard right. The reconciliation bill that's being proposed, the moderates are like, we're going to lose our jobs because we will steal healthcare from more people than we won our elections by. Representative Miller Meeks from Iowa, she won her election by 800 votes, or somewhere right around 800 votes. If this goes through, something like 67,000 people in her district lose their of her constituents.
Right.
So they'll definitely lose their job if they get this through. On the other side of the Republican caucus, you have, these arsonists who actually drive the party who are saying, we need to hurt more people. We need to just totally destroy everything. And this is getting pretty close to totally destroying everything, but nothing is enough for the arsonists. So Speaker Johnson has a really hard balancing act to pull off to get all those votes. And you know what doesn't help him get the votes? Donald Trump's poll numbers being subterranean, right? When he's polling in the 30s and 40s on his handling of the economy, the thing that got him elected, he's way underwater on. He's underwater on cost of living, handling the economy, Social Security. These are the three top priorities, according to recent public opinion polling, and he's underwater on all of them. So he's just trying to deal with that, right? The executive order on drug prices, it's not going to actually lower people's drug prices. I am good with Republicans saying drug prices are too high, though, Egberto. I'm not going to fight them on that. I'm like, I want more of them to say it. In the House, Republicans will not say that because they need pharma dollars. But it's the executive order is to try to take care of his sagging poll numbers on cost of living, that's drug prices, and the economy, that's the tariff announcement with China agreed over the weekend. That is just a 90-day pause, right? The trade deals take way longer than 90 days. And so this is, again, it's all about creating a narrative going into tomorrow that they're going to try to pull out for the rest of the week. And we have to be truth tellers and be like, don't fall for it. You have to keep your eye on the actual scorekeeper here. The Congressional Budget Office says, it's not about what Donald Trump said this morning. The Congressional Budget Office says 13.7 million people lose their health care to give trillions of dollars in tax handouts to billionaires. That's what's going on.
Well, you know what is so important, and I want to go a bit off topic because this is extraordinarily important when you mentioned about bonds. I want folks to understand that before Trump came into office, the Treasury bonds were selling at about 3-point-something%. We're all the way up to 4-point-something% without making any changes to the budget at all, without any tax cuts or anything already. We are at 4-point-something% on the bonds. What that means is that we have increased our deficit spending for the next fiscal year by billions of dollars before we even start trying to cut taxes. What Alex is talking about there is more important than most understand. So yes, this is window dressing. This is smoke and mirrors from Donald Trump, but it's something that we have to be aware of, that if something happens this week where these guys come out and say that they have some deal with us, knowing that this is a fraud, think about what's going to happen to the bond going forward. Okay, give me a closer as far as what America should be doing, what our constituency or listeners should be doing in the next few hours, in the next few days, because of how substantive this week is going to be with regards to building that budget, if you will.
The key is hands off Social Security, hands off Medicaid, hands off SNAP, hands off Meals on Wheels. These are things, programs, systems that we've built, that we've earned. And the Republicans are trying to steal them from us to give tax handouts to billionaires. So we need to make as much noise as possible. There's a lot of stuff happening in Washington, D.C., but we also, Egberto, we've spoken about it. We say, get local. Go to your local Social Security office. Get your friends. Put a note, send a note to us at socialsecurityworks.org. I'm A. Lawson at socialsecurityworks.org. We'll help you find people to in your location. Go to a Social Security office. Get some signs. Hands off Social Security. Go to a local hospital. We haven't even gotten into it, but especially if you live in a rural or urban area, if this goes through, your hospitals are done. They're gone. Especially the rural hospitals, they're closing left and right now. So hands off Medicare, go to your local hospital. Call the news and politicians, especially if you live in one of these marginal Republican districts. Get your elected official on the record. What are you going to do to protect our hospital? What are you going to do to protect our Social Security office? Educate people about the consequences of what's going on. And of course, call your members of Congress. And for this, the reconciliation is both the House and the Senate. And we just need to make as much noise as possible. It's the House right now, but it'll have to go over to the Senate. They have disagreements in each house. So in the House, they don't agree as a party. In the Senate, they don't agree as a party. And then the two houses, Senate and the House, don't agree with each other. So we just got to get in there and talk to all of the moderates, everybody, and say, look, if you vote to steal our healthcare, we're going to vote to get you out of office, right? Like, just educate people as to what our plans are if they actually go through with stealing, and really think about what that means. Almost 14 million people's healthcare. What are they supposed to do? Die? Yes, that's the plan for them. There is no other plan. When you take a person's healthcare away, and you're talking about the most vulnerable in our society, the oldest of the old, people with disabilities, people in nursing homes. And there's worse stuff on nursing homes. They're going to lower the amount of staff in nursing homes at the same time they cut funding. They'll turn nursing homes into death traps. Your family members will not be safe at all in a nursing home. That's what's at stake here. So hands off Medicaid, hands off Meals on Wheels, hands off Social Security, and say that as loud as possible in as many venues as possible.
Folks, stay tuned to Egberto Off the Record on Politics Done Right. We've been covering these issues, including the closure of rural hospitals and why we've gotten professionals to speak about that as well. And we are also locally here in Kingwood and throughout Texas. We're discussing that and having symposiums, etc., for people to find out about this. So folks are on the ball. We need all of those that are listening to us to be on the ball, as well as sharing all this information. Alex Lawson, who is again the Director of Social Security, the Executive Director of Social Security Works, thank you so kindly for having appeared on Politics Done Right on this short notice. You have a wonderful rest of your day.
Thanks for having me.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.